Good day. This is a case report on the use of percutaneous doxycycline ablation for recurrent aneurysmal bone cyst in the sacroiliac joint. ABCs are expansile blood-filled reactive lesions of the bone, which are benign but can be locally destructive. Prevalence of ABCs are rare, amounting to be 1% of primary bone tumors, with the most common sites observed to grow along metaphysioepiphyseal areas of long bones, along the spine, and commonly the sacrum, and rarely the sacroiliac joint. Treatment principles include surgery. Minimally invasive methods have been proposed due to higher destabilizing effects of curettage in large lesions or those involving hard to reach areas, including the pelvis or the sacrum. With this paper, we aim to describe a case of local recurrence of ABC in the SI joint after curettage and then treated with percutaneous intralesional off-label doxycycline ablation, as well as its outcome. I present MC, a then 28-year-old female who initially presented with low back pain radiating to the left leg and with toe extensor weakness, no bowel or bladder incontinence, and thereafter workup was done. X-ray showed suspicious radiolucent areas adjacent to the left SI joint. And on MRI, an incidental finding of a multicystic lobulated mass encroaching the left neural foramen at S2 and S3 was shown. A CT-guided biopsy was done and showed findings of ABC. Embolization was done and showed devascularization of the feeding vessels branching from the lateral sacral and superior gluteal arteries. She underwent excision curettage, electric cauterization with application of synthetic bone graft on the defect. Reconfirmation of an ABC diagnosis was noted. Grossly, typical spongy, multiloculated hemorrhagic lesions were seen, and on histopathology, blood-filled cystic spaces with giant cells were observed. During the interim, the patient became apparently well. Until around 1 year post-op, she started to experience a recurrence of low back pain and radiculopathy to the left, still without bowel or bladder symptoms. MRI again showed the multicystic lesion along the left sacrum and SI joint, encroaching the S2 and S3 vertebra. Repeat CT-guided biopsy of the mass was done, and ABC recurrence was established. The patient was indicated for wide resection and spheno-pelvic fusion but opted for a non-invasive approach. Hence, she was referred to interventional radiology for co-management and underwent percutaneous doxycycline ablation under CT guidance. The ablation agent was prepared minutes prior to injection, as shown on the following. And in each session, a pre-ablation CT scan was done to determine the injection sites. These post-procedural scans showed ablation of the mass, and the number of sessions were based on a decrease in tumor volume and increase in intralesional bone formation. These were apparent especially after the third session, and shown as the interval formation of neural foramen with increasing hyperdensity within the cyst. A clinical improvement in pain signifies this. On latest CT scan after her sixth session, significant demonstration of cortical thickening was noted. In a review of literature, a retrospective study in 2001 reported in 40 patients with ABCs of the pelvis and sacrum, 9 were intra-articular and only 2 occurred at the SI joint. In addition, only 1 case report is available showcasing ABC in the right SI joint. However, among the studies available, there is no reported incidence of ABC in the aforementioned area. As mentioned, mainstay of treatment is curettage with or without bone graft or cement, and recurrence rate amounts to 12 to 71%. Adjuvant methods, including cryotherapy, has been established, but risks outweigh its benefits. Partial or unblocked resection has been reported to have cases with no recurrence, but can lead to destabilizing effects to the bone. Embolization decreases intraoperative bleeding. Initial reports mentioned it can reduce recurrence rates, but recent studies show otherwise. Radiotherapy has been reported of having good success rates, but are reserved for selected recurrence due to possibility of secondary malignancy. Primary treatment of ABC with intraosseous doxycycline injection has been reported with the aim of restoring normal anatomy and function while reducing local recurrence and minimizing morbidities. Doxycycline is used as a chemical ablation agent admixed with albumin and has been reported to have properties that target malignancies while preventing bone resorption. A retrospective study by Shields in 2013 showed preliminary outcomes of patients diagnosed with ABC, 2 involving the sacrum and treated with doxycycline ablation. There was noted a significant decrease in lytic lesions seen during the third session with increased cortical thickening similar to our patient. And there is 5% overall recurrence rate and no major complication. This case report highlights a small percentage and peculiar location of ABC, which was found to be in one of the SI joints. We likewise report the only known local experience using non invasive treatment for local recurrence of ABC and the SI joint by a city guided intralesional ablation of doxycycline, along with an adjunct of preoperative selective arterial embolization with promising outcome as of date.